Hi everyone, and welcome to today's video. We're going to be discussing interstitial cystitis. It's a chronic condition that can be incredibly challenging both physically and emotionally. Now if you're dealing with this, I want to acknowledge how difficult it is and how difficult it can be to manage the symptoms day to day. It's a condition that affects the quality of life, but it's also important to remember that you're not alone. In this video, we're going to be looking at what interstitial cystitis is, its symptoms, and the different treatment options available, including natural approaches. It's often referred to as painful bladder syndrome. It's a condition that involves chronic bladder inflammation and pelvic pain and frequent urination. It affects both men and women, although it's more common in it's more common in women around the age of 40. Now, unlike other typical urinary tract infections, interstitial cystitis isn't caused by an infection, and there's no specific pathology or single cause we can pinpoint. Now, the research currently coming out is suggesting that E. coli is residing in oxalate crystals in the bladder's epithelium, and that this can play a role in interstitial cystitis. But overall, the condition remains somewhat of a mystery. It's important to know that it's not life-threatening, but it can really seriously affect your quality of life, often leading to anxiety, depression, and chronic pain. So some common symptoms include frequent urination, pelvic pain, pain in the urethra, blood in the urine, and chronic pelvic pain or painful intercourse. These symptoms can come and go, but interstitial cystitis generally doesn't resolve on its own, and for many it is a lifelong condition. Now, diagnosing interstitial cystitis usually happens after ruling out other potential causes for pelvic pain like urethritis, bladder infections, bladder cancer, endometriosis, and vaginitis. Your healthcare provider will perform tests to eliminate those conditions, but unfortunately there's no definitive test for interstitial cystitis. Conventional treatments mainly focus on managing your symptoms, and whilst there is no cure, some medicines and therapies do seem to reduce the discomfort. They include amitriptyline, which is an antidepressant, and it's sometimes used to manage mood and pain. Antihistamines, which are prescribed if you are allergic or sensitive to allergens. And pentosan polysulfate sodium, which can promote remission, but it can take months to show results. So pain management can include non-steroidal anti-inflammatories and opioid analgesics, but these can come with side effects. Intravesical treatments, which are treatments inserted directly into the bladder, may also be considered, such as DMSO or heparin. And these options can offer relief for some, but results are often temporary, which then leads people to surgical options such as hydrodistension, which if the bladder is stretched, it may help for a while, but it can be risky and it comes with complications such as bladder rupture. So living with interstitial cystitis can be emotionally draining. The chronic pain and the constant urge to urinate can make everyday activities difficult and lead to feelings of isolation, frustration, and even depression. If you're experiencing these emotions, I just want to remind you that the feelings are valid, and reaching out for emotional support is just as important as managing the physical symptoms. Now let's talk about herbal approaches and what can be provided holistically. So these treatments are focused on addressing the pain, the inflammation, and the allergy responses that may contribute to interstitial cystitis. Key herbs are marshmallow root and slippery elm, which are demulcent herbs that soothe and coat the bladder lining. Anti-inflammatory herbs such as birch, echinacea, goldenrod, and licorice are useful to help reduce inflammation. Analgesics such as cannabis, kava kava, and peony are helpful for pain relief. And bladder tonics such as horsetail and corn silk can help support bladder function. Now you also want to consider bladder circulation, so we're going to give herbs like cleavers for the lymphatic tissue. Astringent herbs like ephedra might be helpful to improve bladder tone, and quercetin or nettle can be helpful in reducing the allergy related symptoms. Onto the diet and lifestyle. So diet can make a huge difference for some people with interstitial cystitis. Many find relief in following a low-oxalate diet, which reduces the buildup of crystals in the bladder, and it's important to avoid caffeine as it can be pro-inflammatory and irritating to the bladder. Supplements like L-carnitine and D-mannose have shown promise in addressing interstitial cystitis over time, and bladder retraining is another key approach helpful to gradually increase bladder capacity. Now, stress management is an important aspect of living with interstitial cystitis. Chronic stress can exacerbate symptoms, and so finding ways to relax, reduce stress, whether it's through meditation or prayer or sitz baths for pain relief, can be really helpful. TENS machines have been shown helpful with pain management whenever they're used daily for maybe 30 to 20 minutes a day. These devices send electrical impulses into the affected area, providing non-invasive options for pain relief. So this is a complex condition, but it is important to remember that whilst there's no cure, there's many ways to manage the symptoms and improve the quality of life, from herbal remedies right through to dietary changes and pain management techniques. Thank you for watching the video. Hopefully you find it helpful. And if you are living with interstitial cystitis, I just want to encourage you to be patient and kind to yourself. Do like, subscribe and share the video with anyone who you think might benefit. And take care. And I will see you on the next video.